Conditions that mimic hypoglycemia. If you find this information helpful, don't forget to give this video a thumbs up and share it with others who may benefit. Also, make sure to subscribe to our channel for more informative content on diabetes management. Hello, and welcome back to our channel. I'm your host, and today we are going to discuss a topic that is often misunderstood in the diabetes community. Conditions that mimic hypoglycemia don't get misdiagnosed. As a diabetes expert, I often encounter individuals who believe they are experiencing low blood sugar when, in fact, there might be an entirely different explanation. So, let's dive into this important subject and shed some light on it. The importance of recognizing hypoglycemia. Before we delve into the conditions that mimic hypoglycemia, let's quickly recap the significance of understanding and recognizing true hypoglycemia. Hypoglycemia, or low blood sugar, occurs when the glucose levels in your blood drop below normal. It is a common side effect of diabetes medication, such as insulin or certain oral medications. The symptoms of hypoglycemia can vary from person to person but often include shakiness, confusion, sweating, dizziness, and even loss of consciousness if left untreated. It is crucial to recognize these symptoms promptly and take action to raise blood sugar levels to avoid potential complications. Conditions that mimic hypoglycemia. Now, let's shift our focus to conditions that can mimic hypoglycemia. These conditions often exhibit symptoms similar to low blood sugar, leading individuals to believe they are experiencing a hypoglycemic episode when, in reality, something else is going on. It is important to be aware of these conditions to avoid unnecessary treatments and confusion. Anxiety and panic attacks. The first condition we will discuss is anxiety or panic attacks. Anxiety can cause a surge of adrenaline, leading to symptoms that mimic hypoglycemia, such as rapid heartbeat, sweating, trembling, and even lightheadedness. It is crucial to differentiate between true hypoglycemia and anxiety-induced symptoms to receive appropriate treatment. If you experience these symptoms but your blood sugar levels are within the normal range, it is essential to consider anxiety as a potential cause. Consulting with a mental health professional can help you manage anxiety and prevent unnecessary confusion with hypoglycemia. Adrenal insufficiency. Another condition that can mimic hypoglycemia is adrenal insufficiency. This condition occurs when the adrenal glands, located on top of the kidneys, do not produce enough hormones, including cortisol. Low cortisol levels can lead to symptoms that overlap with hypoglycemia, such as fatigue, weakness, and dizziness. If you suspect adrenal insufficiency, your healthcare provider can perform specific tests to evaluate your adrenal function. It is crucial to diagnose and manage adrenal insufficiency properly to prevent potentially life-threatening complications. Thyroid disorders. Thyroid disorders, such as hypothyroidism or an underactive thyroid, can also mimic hypoglycemia symptoms. When the thyroid gland does not produce enough hormones, it can lead to fatigue, weakness, difficulty concentrating, and even depression. These symptoms might be mistaken for low blood sugar in individuals with diabetes. If you suspect a thyroid disorder, make sure to consult with your healthcare provider, who can perform thyroid function tests and provide appropriate treatment if necessary. Managing thyroid disorders effectively will not only alleviate the hypoglycemia-like symptoms but also improve overall health. Medication side effects. Additionally, certain medications can cause side effects that mimic hypoglycemia. For example, beta blockers, commonly prescribed for heart conditions, can mask the typical signs and symptoms of low blood sugar, making it difficult to recognize a true hypoglycemic episode. If you are taking medications and experience symptoms similar to hypoglycemia, consult with your healthcare provider to evaluate whether any medication side effects might be responsible. Adjustments to your medication regimen can be made if necessary to alleviate these symptoms. Differentiating between hypoglycemia and mimicking conditions. Now that we have discussed several conditions that can mimic hypoglycemia, let's focus on differentiating between true hypoglycemia and these conditions. It is crucial to monitor your blood sugar levels regularly, especially during episodes of symptoms resembling low blood sugar. Keeping a detailed log of your symptoms, along with your blood sugar readings, can help you and your healthcare provider identify patterns and determine whether the symptoms are related to low blood sugar or another condition. Additionally, seeking medical advice and diagnostic tests from professionals in the respective fields can provide clarity and accurate diagnoses. In conclusion, it is important for individuals with diabetes to be aware of conditions that can mimic hypoglycemia. Anxiety, adrenal insufficiency, thyroid disorders, and medication side effects are just a few examples of conditions that might exhibit symptoms similar to low blood sugar. By understanding these conditions and their symptoms, you can work with your healthcare provider to differentiate between true hypoglycemia and other potential causes. Proper diagnosis and management of these conditions will not only prevent confusion but also ensure you receive the appropriate treatment for your specific needs. I hope you found this information helpful and informative. Remember, it is crucial to consult with your healthcare provider for personalized advice and guidance. If you have any questions or want to share your experiences, please leave them in the comments below. Don't forget to hit that like button and subscribe to our channel for more valuable content. Take care, and I'll see you in the next video.